สวัสดีครับสวัสดีครับสวัสดีครับ สวัสดีครับทุกท่านสวัสดีครับสวัสดีครับสวัสดีครับสบายดีไหมครับสวัสดีครับไม่ได้ไลฟ์มานานคืออยากจะมาเซฮัลโหลทุกท่านนะครับ So I think we're gonna speak in English today because I haven't done an English video in a while. So I guess you guys can practice your English today, and you can write the comment in English below if you want. ถือว่าวันนี้ฝึกภาษาอังกฤษกันหน่อยแล้วกันนะครับผมไม่ได้ทำวิดีโอเป็นภาษาอังกฤษมานานแล้วก็อยากจะทำวิดีโอเป็นภาษาอังกฤษสักนิดหนึ่งนะครับ so yeah, today we're going to do the video in English, and yeah, I'm sorry I've been away for a while and we haven't done any live for a while, or I haven't had new videos. It's just that I've been so busy, you know, been very extremely busy over the past weeks, and I have so many of my medical students that are going to take the USMLE in the coming weeks. So you know, I've been helping them out, trying to help my students get the best score as possible, you know, so they can have a bright future in medicine. And I've been doing catering my notes to them, and then doing extra tutoring for them, and hopefully my students will do well in the USMLE. And also, you know, I have a vacation coming up, so you know, I've been working extra hard non-stop, so I can have like, you know, a restful vacation when I go on vacation. And as I said, medicine is a universal language. English is the universal language in medicine, so I guess this is good for Thai medical students who want to practice medicine in the USA one day in the United States, because you know the USMLE is in English, right? So you have to practice your English to be able to get a good score on your USMLE. And yeah, so today we're gonna do some questions, and as I said, you know, I've been really just busy with trying to get everything done, my work, paperwork, students, tutoring, my medical lectures and stuff like that. And also we're still trying to do a QBank, you know, our QBank project for the students in the future. It's just that, you know, I'm not a business person or anything, so you know, I take 2 steps forward in the QBank project, then it takes two steps back. So I'm gonna try my best to try and get this QBank going, and of course QBank is very important for medical students, right? Because it allows the student to practice their knowledge, to apply their knowledge, because it is so easy for people to memorize stuff and regurgitate stuff when you go to class, when you go to medical school. It's so easy to memorize it, but that knowledge is useless. It's not useful. You can't apply. You have to be able to apply your knowledge. So, for example, I think I've given this example before. It's just like, maybe there's so many types of pain medication, right? There's NSAID, and there's also acetaminophen or paracetamol, right? And you know, like each of these medications, they leave the body like via the different system. Like NSAID, like ibuprofen, the byproduct of the medicine leaves via the renal system, so you pee it out. It leaves via the kidney. The kidney gets rid of the medication. And medication like acetaminophen or paracetamol, our liver get rid of it. Our liver get rid of the byproduct. So you might see a question like somebody who's been drinking a lot of alcohol and has liver disease, like fatty liver or something, and they have a headache at the same time. So the question might come like, what kind of medication will you give them? And the answer would be like, ibuprofen or NSAID, right? Because you don't want to avoid you want to avoid the liver. You don't want to go near the liver. So you want to give a medication that leaves the body with the kidneys, with the renal system. So that would leave your kidney alone. So that would leave your liver alone. And that's the example of how to apply your knowledge, right? So this is a Cuban project, and as I said, I'm trying to find people in the medical education industry to work with me on this, and we're gonna get it done. So today, I want to quickly do a USMLE style question with you, with you who are interested. And today I want to do a question about endocrine. Because last time I explained to you about the relationship between prolactin, dopamine, and also the gonadotropin releasing hormone. So that's the dynamic that's going on, and usually dopamine would inhibit the prolactin, and this is very prominent in psychiatric medicine, right? So in psychiatric medicine, some people who has let's say schizophrenia, somebody has visual hallucination or auditory hallucination, right? And they get hallucination because that level of dopamine is too high. Dopamine is way too high. So the doctor would give that patient antipsychotic, right? Like haloperidol or something. And the goal of haloperidol is to bring down the level of dopamine. And once the level of dopamine is down, the level of prolactin will go up. And prolactin, of course, that function is going to cause patient to lactate. The milk's going to flow, lactation, right? So when the patient dopamine goes down and prolactin goes up, what happens? Prolactin would inhibit gonadotropin releasing hormones. So basically it inhibits the FSH and LH. That's the hormones that's needed for like menstrual cycle, right? So the patient's not going to be able to like get pregnant. And that's you may see a student may see a question in that this patient is on antipsychotic, and once the patient's on antipsychotic, the dopamine level will go down and the prolactin level will go up. And you might see in the question stem that the patient's unable to have kids, or the patients have amenorrhea, or the patient doesn't have menstrual cycle. And so that's I'm going to explain that later on when we do an endocrine question. But at first, last week I saw a couple of first year medical students, so we talked about inflammation. And so I want to share with you just real quick about inflammation, that inflammation is a natural process. It's a natural immune response of our body. So we have an injury somewhere to our hand, or bacteria enter our hand or something like that. Our body will have inflammation, right? Inflammation is to fight the pathogens, or to get rid of the bacteria that comes into our body. That's inflammation, right? And so inflammation is good. If you have inflammation, that means our body defense against pathogens, against bacteria, or immune response is normal, right? So it's good. Inflammation is good. But if too much inflammation, you lose, you have loss of function. And that's why you take anti-inflammation medication, and basically inflammation, you have a few symptoms, right? You have pain, you have swelling, you have redness, you have heat, and then also you have loss of function. Those are inflammation. And what happens during inflammation is just like your blood vessel, right, will dilate. And once your blood vessel dilate, that's when you get, that's when you get swelling. That's when you get swelling. Why does a blood vessel swell or dilate during inflammation? It's so, the blood flow would go to the area that's injured. And what's in blood, oxygen, right? Oxygen and nutrients can go and heal the area that's injured. And also our white blood cells, such as neutrophils, white blood cells that like fights against pathogen, fights against bacteria. So the neutrophil can go to the injured area and try and get rid and try and fight the pathogens and fight the bacteria, so you can get better. And then also, increasing blood flow, that's like oxygen will go to the injured area, nutrients will go to the injured area, so you can heal faster. And that's inflammation, part of your immune response. And too little information, right? It's not good. If you don't get a lot of information, that means like the white blood cells not fighting the bacteria, and the area of injury is not getting enough oxygen, it's not getting enough nutrients, so the bacteria can like really destroy that tissue. It can really cause that tissue to die if you don't have a lot of information. And too much information, of course, you lose function. Maybe you've got information of the eye, or information of like the airway, information of the area. If it's too much information, you're not going to be able to breathe, and that's a real danger, right? You can't breathe, you're gonna die. You can't breathe, you're gonna die. And if you have information too much, maybe you can't see or anything like that. So there has to be a balance with information. Little information is not too good because your body's not going to get rid of the bacteria, your body's not going to get rid of the pathogen. Too much information, you lose your function. You have a loss of function. So just want to say that information is a natural immune response that your body have, right? Okay, so that's that. And today we're gonna do a USMLE style question. Now I'll read the question out to you, okay? So the question, this is an question about endocrine, right? So 32-year-old woman presents with amenorrhea, galactorrhea, and visual field defects. All of several months duration, so in all several months duration. MRI reveals hypophyseal mass imaging on the optic chiasma. This is most likely what? So the question is like, you have to diagnose this question. The patient have amenorrhea, that means the patient is not having menstrual period. The patient's not having the patient not ovulating, and the patient has galactorrhea. That means the patient has is producing milk, and the patient has visual field defects, so the patient can't see properly, and the MRI reveals hypophyseal mass. So that's basically say that the patient has a tumor on the pituitary. So the patient has pituitary adenoma, and that pituitary adenoma is on the optic chiasma, right? So the question is asking like, what does the patient have? Like what is it? And the choices are A, prolactinoma, B, somatotropic adenoma, C, corticotropic adenoma, D, craniopharyngioma, and E, acidophilic adenoma. And adenoma, by the way, is it means that's a tumor. Adenoma means a tumor that's coming from a secreting gland, right? That's adenoma. So pituitary is a gland that secretes hormones into your bloodstream. So if you have a tumor in the pituitary, that's called adenoma, right? And if you have a cancer of the adenoma, if you have a cancer of the gland secreting, that's adenocarcinoma. It's different from like normal carcinoma. You have carcinoma is actually cancer of epithelium tissue, right? That's carcinoma. And carcinoadenoma is the cancer of the gland, right? And in this case, the patient has some kind of adenoma, pituitary adenoma. So the patient has a tumor that's growing on the pituitary, and it's not necessarily cancerous. So it's some kind of adenoma, right? So I'm gonna highlight what we should highlight during the exam. And of course, I've said many times, like during the exam, when you're doing these questions, you should highlight the keywords. So when you get lost in a question, then you can look at what you highlight, and then that should like steer your mind onto the correct answer, the correct differential diagnosis, right? So I usually highlight what they ask for. In this question, they ask for diagnosis. They ask like, what does the patient have, right? And then I like to highlight the age of the tumor. Age, sex is important. So this question, it says that the woman is 32-year-old. That's during like reproductive age. So she should be having like normal menstrual cycle, but she's not having a normal menstrual cycle. She's having amenorrhea. So the age is important, age and sex, and the patient present with amenorrhea, right? She's not having normal. She's not having like menstrual period, and the patient has galactorrhea, so she's producing milk, and the patient has visual field deficit, or something's wrong with the visual field, right? And MRI reveals that she has pituitary adenoma. She has a mass on her pituitary, right? And the mass on the pituitary is pressing on the optic chiasma. So this is what I would highlight. And again, once I get lost, if I'm doing this question and I'm getting confused and everything like that, I'll just read over what I highlighted, and then like that should stay my mind back on track to try and come up with differential diagnosis to answer this question. So basically this woman, right, she has amenorrhea. She doesn't have her period, and she has breast milk. Her breast is producing milk, and she has visual field effects. And MRI shows that she has pituitary adenoma on her optic chiasma, right? So basically, this question tells us that the woman has pituitary adenoma, and it's just basically asking us what kind of tumor is it? What kind of tumor is it, right? So you could easily tell that this patient has pituitary adenoma, because it just says right there. It says that the MRI shows that there's a pituitary tumor, pituitary adenoma pressing on the optic chiasma. So the optic chiasma is actually part of the optic tract, and the optic tract obviously that's cranial nerve 2, right? That's optic nerve. So your visual field when you see, that's cranial nerve 2. So cranial nerve 2 comes from your retina, and then that's going to be an optic tract. Optic tract will cross each other, and when that crosses in the brain, that's called the optic chiasma, and then that goes back to your primary visual cortex. So the thing is that the optic chiasma is like 10 millimeter above your pituitary gland, right? So if that's a pituitary tumor, pituitary adenoma, it's gonna press against the optic chiasma, right? And the thing is that the thing about the optic tract is that, or optic nerve, is that it that's like there's two visual fields. It's like there's a nasal visual field, which is like allows you to see straight forward, and there's a temporal visual field, which allows you to see like on the peripheral side, right? so that the peripheral visual field is like you see on the outside, and the nasal visual field is like you allows you to see forward, right? And the thing is that the optic chiasma, right, is in the middle like this. And when the pituitary tumor presses on the optic chiasma, it presses on the fiber that's coming from the temporal field. So the patient has blindness on the temporal field. So the patient will have tunnel vision, right? And that's what it says right here. It says on the question stem that the patient has pituitary adenoma from the MRI, and the patient has visual problem. So now we get the vision that the patient, has tunnel vision because the pituitary tumor, the pituitary adenoma, is pressing on optic chiasma, and the patient has temporal field blindness. So the patient has tunnel vision, and basically, the question is asking what kind of tumor is it, because the pituitary has so many cells, right? The pituitary has cells that controls the secretion of hormones, the secretion of sex hormones, the secretion of hormones that controls lactating. So this question is asking what kind of tumor? What kind of tumor is it? Is it prolactin? Is it prolactinoma? Is it somatotropic adenoma? And then we have a very, very good clue in here. The clue in here is that the patient has amenorrhea and the patient has galactorrhea. So that means the patient's producing milk, right? And if the patient's producing milk, then any medical students would know that this patient has prolactinoma. Prolactinoma is a tumor coming from the cell that produce prolactin, coming from the cells of the gland that stimulate your breast to produce milk, right? So this patient has prolactinoma. And the thing about prolactinoma is that so this tumor is gonna this tumor is gonna release prolactin more, the hormone prolactin, and prolactin is gonna make the patient produce milk, right? And then of course prolactin inhibits gonadotropin releasing hormones, and gonadotropin releasing hormone, that's sex hormones, that's the hormones that produce LH and FSH. And LH and FSH, those are the cells that make sure that the patients produce progesterone, the patient produce estrogen, the hormones that are essential, that controls the ovulation, that controls the menstrual cycle, right? So if that's high prolactin, the patient's not going to ovulate. So this is why the patient has amenorrhea. This is why the patient has doesn't have her menstrual cycle, because the patient has prolactinoma. The patient has too much prolactin that it makes the patient secrete milk. And once the patient secretes milks, the sex hormone, the gonadotropin releasing hormone is going to go down. And when gonadotropin releasing hormone goes down, right, there's not going to be FSH, there's not going to be LH, so the patient will not have ovulation, the patient will not have menstrual cycle. And if you think about it, actually, it makes sense because the patient, if somebody's breastfeeding that baby, right, this is kind of like an evolutionary thing. It's like the biological evolution. If a mom, let's say if a mom just gave birth to the baby, and the mom's breastfeeding the baby, right? And when she breastfeeds the baby, she could not get pregnant again because when she's lactating, when she's giving milk, right? That protein prolactin is going to inhibit sex hormones, so she's not going to be able to ovulate. she's not going to be able to have menstrual cycles. That prevents her from having any more babies. And the evolutionary process is that, when you have a baby and you're breastfeeding her, you can't get pregnant at that time because nature wants you to take care of one baby at a time. Take care of one baby at a time. So make sure that baby is old enough. And then, once the baby doesn't breastfeed anymore, then you can have more baby. So that's why prolactin inhibits sex hormone. And that's what's happening here in this question right here. Another thing is that, as I said, in psychiatric medicine, you can see a lot about prolactin, about dopamine, about gonadotropic releasing hormones. And I said, a patient who has schizophrenia, right? When you have schizophrenia, it could be visual hallucination, it could be auditory hallucination. That's because the patient dopamine level is so high. When the dopamine level is so high, you can get auditory hallucination or visual hallucination. And the medicine that you give the patient who has schizophrenia is a medicine that will try to bring down your dopamine level. So you give a patient haloperidol or something like that, antipsychotic. You give patient haloperidol, that's going to bring down the patient's dopamine level. But once the dopamine level goes down too much, the prolactin hormone is going to go up. And when the prolactin hormone is going to go up, the patient is going to lactate. And once the patient lactate, that's going to inhibit gonadotropin releasing hormones, going to inhibit sex hormones. So the patient who's on very, very high doses of antipsychotic will complain to a doctor that they don't have menstrual period, that they don't ovulate. So that's one of the things that you're going to look for in a psychiatric medicine. But this question right here, the patient has pituitary tumor, and the pituitary tumor is causing the patient to have amenorrhea and galactorrhea. And also we know it's pituitary tumor because the patient has tunnel vision. The patient has tunnel vision because the pituitary tumor is present on the optic chiasma, right? So we know that, and we figure out that the answer is prolactinoma because of the clue that's given us that the patient has amenorrhea and galactorrhea. And so what are some other choices? Some of the choices that we have. So choice B is somatotropic adenoma, and that's basically is too much growth hormones. So too much growth hormones. So B, somatotropic adenoma, the patient will have what we call acromegaly, right? That's when your pituitary is producing too much growth hormone, and basically your soft tissue will harden. Your soft tissue will overstimulate. The patient will have, maybe bigger forehead. The skin will be more rough, bigger tongue, bigger fingers, or something like that. That's acromegaly. And corticotropic adenoma, choice C, what is that? That is when the tumor of the anterior pituitary is producing too much ACTH, and ACTH controls the cortisol level that your adrenal gland gives out. Above your kidney, there's a small gland, that's the adrenal gland, and the cortex of that gland produces cortisol, right? So if this patient has corticotropic adenoma, this patient will produce too much cortisol, and that's going to cause the patient to increase weight. So the patient will be a little fatter. The patient might have a buffalo hump on her back, and what else? The patient will have moon face. So that's all from too much cortisol in your body, right? Choice D. Craniopharyngioma. That's usually pituitary adenoma in young kids, right? In this case, this is where embryological tissue becomes a tumor, right? So that choice is not the choice. Choice E, acidophilic adenoma. That's too vague. Acidophilic adenomas are the cells of the anterior pituitary. All the cells anterior pituitary, basically, they're acidophilic dye, right? So that's not the choice. That's very vague. So the choice here is prolactinoma. And I know it's kind of difficult to understand right now because I need to put some graphics on here so you guys will understand, and then that'll be easy for you to understand once I put the graphic on here. But I just want to come by real quick and then just say hello and do a few questions with you. And today, as I said, we spoke in English. วันนี้ฝึกภาษาอังกฤษด้วยกันนะครับก็ฝึกภาษาอังกฤษทำ question หนึ่งนะเกี่ยวกับendocrine นะครับแล้วก็อย่างที่บอกนะว่าอาทิตย์ที่ผ่านมาผม busy มากกับนักศึกษาแพทย์กับการงานของผมแล้วก็พยายามทำ QBank project ที่ผมจะทำให้นักศึกษาแล้วก็พยายามจะทำเจอหลายคนที่จะช่วยเกี่ยวกับQBank project ของผมนะครับผมเลย busy มากแล้วก็อย่างที่บอกเนี่ยการแพทย์ในภาษาการแพทย์คือเป็นภาษาอังกฤษใช่ไหมครับวันนี้เลยพยายามจะทำวิดีโอภาษาอังกฤษแล้วก็อยากจะมาเซลล์ทุกคนด้วยแล้วก็อย่างที่บอกเนี่ยผมงานเยอะพยายามทำงานหลายอย่างไม่เสร็จภายในอาทิตย์นี้เพราะว่าอีกอาทิตย์หน้าผมไปพักผ่อนเจอ vacation ผมเลยพยายามทำงานที่เยอะที่สุดที่จะทำได้นะครับแล้วก็some switching back and forth between Thai and English พูดทั้งภาษาอังกฤษทั้งภาษาไทยแล้วกันนะครับก็หวังว่าทุกคนจะมีความสุขนะครับแล้วก็มีอะไรน่าตื่นเต้นบ้างครับตอนนี้มีอะไรน่าตื่นเต้นบ้าง Yeah, so I hope that you guys aren't too bored today, but I hope you find this useful, especially the health field students. Okay, ไว้แค่นี้แล้วกันนะครับไว้เดี๋ยวคุยกันนะครับสวัสดีครับทุกท่าน